Hi guys, this is John Adamson, the Rehab Documentation Guru, and today I just want to talk about the importance of the standardized test. Standardized tests to be done at time of eval and on regular intervals and certainly at your discharge. And the reason I say that is that right now I've been involved in helping write a slew of appeals on denials that are occurring for high-functioning patients. And these are care settings where you have nursing involved as well. And as you all know, sometimes nursing and therapy reports conflict. And in fact, and no offense to any nurses that might watch this video, but nursing assessment of mobility and ADLs and speech, language, and swallow is inferior to that of PT/OT and speech. They don't have the skill set, and a casual observation of a patient documented by nursing can sometimes kill the medical necessity of a therapy claim. And so, first of all, if you happen to be a nurse watching this video, please be careful of what you document in your charting about the patient's capabilities in the realms of PT/OT and speech, because you can effectively kill claims. In fact, we're getting a lot of denials from Medicare related to that right now. That's number one. Number two, regarding the standardized tests, PTs, OTs, speech therapists, please make sure you use a standardized test, because well above the efficacy of things like the MDS or the OASIS or the IRF-PI, the standardized tests administered by a skilled licensed professional are far more effective, evidence-based in terms of determining a patient's disability. And the MDS, IRF-PI, and OASIS were meant to be screening tools. They were not meant to be comprehensive assessments. In fact, Medicare very explicitly states that. And they expect that other assessments are going to occur to validate the assessment of the IRF-PI, MDS, and or OASIS. So we need to make sure that we are using standardized tests that not only validate but can refute sometimes the false negatives or false positives that are coming up on these IRF-PI, MDS, and OASIS assessments, because they are not evidence-based. They were designed by Medicare to capture some criteria for functionality, and Medicare did receive assistance in developing these assessment tools, but they are not standardized. They don't have peer-reviewed articles validating their efficacy and determining functionality. And so if that assessment tool negates the necessity of therapy and we're involved, PT/OT, and speech, what are we going to hang our hat on? We've got to hang our hat on evidence-based criteria. And a standardized test is by far the best tool in determining that. So make sure you do a good job of taking standardized tests. Make sure you interpret the information carefully and apply it to things like, does this test show that the patient is safe and effective? For example, nursing reports that the patient's ambulating themselves. Well, they might not be safe. They might be ambulating themselves, and we know a lot of patients that ambulate themselves, but are they really safe? So maybe we did a very comprehensive balance assessment and we found out that they should not be ambulating themselves. They're walking without a device. We found out they really should be walking with a device. That standardized assessment would pick that up. And when it comes to things like what I do, appeals management and claim denials, that will help capture not only the necessity of therapy, but as you're making progress with the patient, you're reassessing the test and the patient's making improvement, you will validate the effectiveness of what you've done. And that's very important in this day and age. So standardized tests. Don't do your evals or reassessments or discharges without them. Anyway, this has been John Adamson, the Rehab Documentation Guru. Please like and subscribe. And as always, make sure you get paid for what you do. Take care and God bless.